men face these days is baldness. So, Dr. Rahul, moving towards a very important topic of our podcast today, there's a lot of stigma around one topic, which is men's sexual health. Every other day we get to know cardiac arrest ho gaya, celebrities, recent news where a lot of celebrities, due to whatever reasons, they are, ye sudden heart attack. What is the entire concept here? Healthcare industry or the health markets are filled with, as you mentioned, these quick fixes. There are a couple of tablets available, oils available, and multiple things that men resort to in order to kind of have their problems resolved. I want to understand from you, what are the long-term dangers or implications of these quick fixes?
In Ayurveda, we believe that, okay, even if the cancer tumor is there are chances of it being not troubling you at all, okay, and staying inside your body as a part of your body. So that guy had pancreatic cancer.
Oh.
And the doctors had said that he has few days to live and all those things. So sir suggested a diet, gave some medication and all. But eventually, he lived for almost 20 years after that episode.
So, living with that tumor inside your body, how does Ayurveda help the body to adapt itself with the tumor?
I usually tell my patients, if you want to enjoy everything in life, especially in the young age or something, except for smoking and boozing, if you want to enjoy life, travel, have food outside and everything, just devote 8 to 10 days of your life for this procedure. Get detoxed, then you can do whatever you want.
Many people say Ayurveda is slow. If a man has a bad infection or severe pain, isn't popping an antibiotic or painkiller faster and a better option?
Ayurveda is very much...
Welcome to Men Unplugged. I am your host Firdaus Mudassir, and today on the show we have a really special guest, Dr. Rahul Marwa, who is an Ayurvedic doctor focusing on lifestyle and diet management programs, who has a very beautiful vision of creating a medicine-free world based on Ayurveda. His expertise lies in gut health and migraine. So let's all dive into and get many insightful tips from Dr. Rahul Marwa. Welcome to the show, Dr. Rahul.
Thank you, Firdaus. It's a pleasure being here.
So before we start the entire conversation, help us understand, doctor, what is the difference between Ayurveda and Allopathy?
So both of them have a different point of view or the way they look at things. So if you see, Ayurveda is more based on the physiological aspects. You must have heard कि वात बढ़ता है, पित्त बढ़ता है,
जी.
कफ का तकलीफ होती है. So we focus more on those physiological aspects while treating or assessing a human being. Similarly, the allopath or the modern science focuses more on the structural part.
Okay.
Therefore, for them, surgery is the ultimate outcome that they see.
Okay.
Because if you have a cancer tumor, for that instance, the radical treatment would be that removal of the cancer tumor after maybe trying for chemotherapy and all those things. But the end goal is like removing that cancer tumor.
Correct.
On the contrary, in Ayurveda, we believe that, okay, even if the cancer tumor is there are chances of it being not troubling you at all. Okay, and staying inside your body as a part of your body.
Oh.
So the treatment that I have seen with my teachers during my college days is where we ensure that your body accepts it as its own part, doesn't trouble you. If it's a small one, it may go away, but bigger tumors, larger tumors may not go away and they may stay as it is.
Right.
And then eventually they don't trouble you. The markers and everything, they come down and eventually the body accepts it as its part and lives a natural life.
Okay.
So this instance which I am speaking of is where my teacher, late Dr. Dilip Gadgil sir, he had shared this experience with us where I guess 35 years ago or 40 years ago, he had a first patient for cancer. And in that, what had happened was he was a grandfather of a student. So she asked him what we can do and what not. So that guy had pancreatic cancer.
Oh.
And the doctors had said that he has few days to live and all those things. So sir suggested a diet, gave some medication and all. But eventually he lived for almost 20 years after that episode.
After the diagnosis.
And he gave an interview also on the TV, I guess Doordarshan or something, where how Ayurveda actually helped him. So the tumor was as it is. There was no shrinkage in the size of the tumor, but the pancreas started working normally, and then eventually he could live a normal life. So that is how we look at things. We don't want to at times the anatomy cannot be changed if there is some kind of tumor or something. But at that time, we can ensure that the body physiologically responds to it in a better way. So
Okay.
that is where both Ayurveda and allopathy differ a lot. Plus, considering dependency on the nature, the Ayurveda medicines have a certain goodness. Okay, because we are dependent on nature. So whatever we get, if it's in a good form, we can give you good results also.
Correct.
Allopathy is all chemical derived or chemical based. So for them, producing at mass becomes
Easier, yeah.
and therefore they become cheaper. But on the contrary, Ayurveda cannot get that cheaper
Right.
because we are dependent
On
on
the nature.
something in the
Yeah.
nature. And the way we are deforesting and doing things, I don't think it would be easier to say that one fine day we can make a cheaper substitute for XYZ.
Right.
That won't be possible.
Okay.
So in this way, both of them differ. Both of them have their goodness as well as some bad, I would say, a side effects or something. But yes, eventually, if you look at the broader picture, Ayurveda is more of a preventive as well as preventive and predictive medicine, I would say.
Okay.
Because depending upon your lifestyle, depending upon your illnesses, family history and all, we can predict certain things that this you may face in your life. But allopathy depends totally upon investigations. For
Right.
them, looking at your current blood markers, they say whether you have certain things or not. So this is a very interesting fact where the blood markers actually, or the blood investigation, they tell you what is there, what's the problem at this current moment.
Right.
They cannot tell you what was there behind or what can come ahead.
Right.
And just with seeing those reports, but with a nadi pariksha, with a diet consultation and everything, we can tell them what next can you face, or what are the challenges you had faced previously, and how all this whole thing is linked one to one. How this whole thing is linked to each other.
Each other. Correct.
So that is how we differ.
Okay.
And we can tell them, okay, this is what you have been suffering. If you don't take care of this, eventually you'll end up in this space.
Right.
In that way.
Okay. Wonderful, doctor. You gave us really good information about how the both these sciences differ.
Correct.
But I would like to ask you a question on the one that you said. I mean, cancer is a huge, it's a big disease.
Correct.
And pancreatic cancer, for that matter, is something very deadly that we all know of.
True.
So, living with that tumor inside your body, how does Ayurveda help the body to adapt itself with the tumor?
So, see, just to give you a simple idea, our day-to-day functioning is based on all what things we do.
Correct.
Okay.
A lifestyle.
A lifestyle, or maybe not lifestyle, I can say in a process. We have a process that we follow. We get up in the morning, do XYZ things. But if you just make a tweak in that, we call it Dincharya in Ayurveda. Okay.
Dincharya.
Dincharya. So there are two things. Dincharya is how you function at a daily basis in terms of having a good health. And then there is Rutucharya, seasonal changes that you need to make in this Dincharya so as to adapt according to the season outside.
Correct.
So once you start following these things, what happens is, even though there is something like cancer inside your body and there are diet restrictions that we give, if you follow that, slow and steadily, your body's metabolism, which has gone for a toss because of this tumor, starts to come back to its normal position.
Okay.
So what happens is, if you come back to your normal position, your body tends to accept as कि अरे ये तो मेरा ही है तो है, but this is me only. Okay, so then it eventually says, okay, nothing doing, let's keep it as it is. Even that tumor doesn't give it a fight back. it says, okay,
It doesn't interfere then.
interfere also.
But it doesn't reduce, it doesn't go off, right?
No. At stage 1 and stage 2, usually we have seen cases where it reverses completely.
Okay.
The tumor might have shrunken in size or something. I'm not a specialist in cancer, just to make it very clear, but I have learned under a teacher who specialized in cancer.
Okay.
So we have seen a lot of cases under him, and even I have seen my aunt who was suffering with cancer, how she went through, where doctor had said only 3 months or 4 months of life. She lived happily for 3.5, 4 years. So I have seen that progression, how things worked, and with all those experience, I'm saying this.
Right.
So, like I said, the body doesn't give it a fight, neither does the tumor fights. So once there is synergy between the two, sab shanti hai, then it's a
Then
happy,
functions well.
the functioning is
Correct.
proper.
Correct.
So what we do is we actually focus on proper functioning rather than eliminating that whole thing.
Right.
These days, allopaths use a lot of antibiotics, and then you
Right.
have something like drug resistance coming up and all. So there is one theory which is known as the germ theory, or the I'm not. It's a German theory where they say that even if any kind of bacteria or virus enters your body, if it's clean and proper, that bacteria won't survive inside. Okay. I think it's a germ theory only, if I'm not wrong. So similarly in Ayurveda, what we do is we ensure that your body inside doesn't give it that kind of an environment where any kind of virus, bacteria
Can grow.
proliferates, and therefore naturally your body acts as an antibiotic kind of a thing.
Okay.
So आपकी body उसको immunity, what we call it as immunity, is actually your body responding in a different way so that these things don't flare up. Now
Correct.
there are multiple factors in that, like आसपास में गंदगी भी उसको affect कर सकती है. So leaving those parts aside, which are under your control, if you follow that, the chances of you falling sick are very less. Secondly, we do something known as Panchakarma. So basically what people say is massage kiya, shirodhara liya, that is Panchakarma, but that's just an allied part.
Okay.
Or like how you see in a surgery, pre-surgical requisites.
Okay.
Okay. But the actual procedure or the actual surgery that is the Panchakarma, which is detoxification. So it's like whatever toxins are lodged up inside your body, every year, at least once or max twice, depending upon your prakruti or your constitution, we ask you to undergo this detoxification. Once that detoxification happens, so whatever cellular level toxins are stuck up inside, they are thrown out by your body.
Okay.
And this is done in 5 ways. We have to choose either one or two. The doctor decides either one or two depending upon your problem, your constitution. So first is by emesis, where we have a vomit करके निकालना पड़ता है, but it's a controlled one. And we give you medication and only limited kind of emesis happen. Then there is purgation. So medicated purgation is like you'll have to pass loose motions and everything will get detox from your body. Number 3 is enema or basti, where majority of your neurological problems or joint related rheumatological issues and all are taken care by. 4th is nasyam, where we put oil into your nostrils and then we clean the upper area. This is very effective in certain emergency conditions like coma and all those things, where we have seen results of this nasya. There are different variations in that. We have seen those kind of results. And lastly is rakta mokshan or bloodletting. All these have a procedure before, during the process and after process. If you follow this, inside your body, all the toxins will be taken care of. So for the next 1 year, you become immune from falling sick.
Oh, wow.
So I usually tell my patients, if you want to enjoy everything in life, especially in the young age or something, except for smoking and boozing, if you want to enjoy life, travel, have food outside and everything, just devote 8 to 10 days of your life for this procedure, get detoxed, then you can do whatever you want to. So those 8 days are crucial for the next 365 days.
Wonderful.
They make you can say, a base platform for all those things in that way.
So, very interesting topic, Panchakarma. So, you recommend all these 5 ways and methods a person should undergo all these 5?
No, No,
Okay.
it's not all 5.
Okay.
So, like I said, depending upon your problem, what you are facing currently, and your constitution, your prakruti, or who you are internally, ठीक है, we decide either one or maximum 2.
Okay.
So accordingly, you have to decide. Okay, either you will go, like this season right now is good for enemas. So those who are having, say, joint pains or something, and they have to undergo such kind of detoxification, for them enema or virechan is a beneficial one. Similarly, now as soon as we land up in Navratris, so during Navratri, many people face liver issues or maybe some kind of acne issues, hair loss issues, and all,
Right.
or even for sexual issues and all. We recommend going virechan or purgation so that the toxins are cleared inside your body. So a simple idea is, if you don't have a traffic jam inside,
Correct.
it would be a free flow movement. You can enjoy the road.
Correct.
So that is how it works. There is no traffic, nobody around. So your body works in a smoother manner. You are happy.
Doctor, are there any side effects of this particular process, Panchakarma?
There are no actual side effects, but yes, the do's and don'ts have to be followed very strictly, because I am forcing your body to remove toxins.
Right.
I'm not intervening with any medication or something. I am ensuring that your body itself tries to throw it off.
Right.
So if you don't follow the do's and don'ts, you'll land up in some other mess. Secondly, at times, under whom you are going to get treated, he should be a proper qualified person.
Correct.
Because I know these days many naturopaths and other allied medical ones, they start their own business. So they say, okay, we'll do Panchakarma. All they do is कि पैसा कमाना है तो करो. Like it's commonly seen with people coming from abroad to India. 7 days में 5 कर्म करके फ्री हो जाते. जबकि ideally it should be only one or maximum 2 in 7 days, depending upon the requirement.
Correct.
So what happens is, if it is not run properly, your body will tend to fall sick much more than what it used to be before.
Right.
So therefore, it has to be done properly. It has to be ensured that you follow things. Like I'll share you a very simple example. A college friend of mine, when we were studying, so he did something known as virechan or the detoxification. And after detoxification, there is a specific diet plan that has to be followed for 7 days.
Okay.
Otherwise, whatever you did is wasted.
Right.
Okay. On the 3rd or the 4th day, it happened to be his birthday. Okay. After doing that process. So everybody said, अरे don't have cake, don't do this. He said, नहीं कुछ नहीं होता, मैं खाता हूँ ये वो. He had non-veg also. He had cake also on that day. Even though in small portion, I don't know. But within a year or so, he developed diabetes.
Oh my God.
And he's still suffering with diabetes.
Oh my God.
So it is so crucial to follow that diet or whatever the do's and don'ts instructions are there, because at the end of the day, what I have done is with my, what you can say, the detoxification process, मैंने ना उफाड़ लेके आया सारे कचरे का. Now all this waste material has come inside your body, which was otherwise kept at one side.
Correct.
अभी वो सब दिखने वाला है, so कहीं ना कहीं वो प्रॉब्लम करेगा. Like how you clean your house.
Correct.
The moment everything is fine, सब पड़ा हुआ है, भले बिखरा है.
Correct.
But जैसे ही आपने उसको सब समेटने के लिए लिया, then it looks like a big mess.
Correct.
Similarly, this happens during this process. So if you don't follow those things, then it will be a big mess for you only. So it's
Correct.
always necessary that you'd follow the do's and don'ts, follow the instructions to the T. Once you do that, next 365 days you're going to enjoy. At least we can devote that 10-20 days for yourself so that there is no problem ahead.
Correct. One last question on Panchakarma. Are there any prerequisites for this? Is it that certain people can do it and certain cannot do it?
So basically, number one prerequisite is age. Anyone below 14 cannot do it. 12 to 14 ideally. And anyone above 70 should not do it. Okay. Only Basti is one such Panchakarma which is okay for all the ages. But then you have the milder versions of it, not the exclusive versions of it. Number two, pregnancy, strict no. Anybody with, you can say, any terminal diseases or just life-threatening diseases, for them it's a strict no. Previously, there used to be something known as filariasis. For it, it's a strict no, Panchakarma. Otherwise, anybody in this today's lifestyle is an ideal candidate for it.
So basic lifestyle diseases like
All
hypertension, diabetes,
everything,
it's not a problem. They
not
can
a
undergo
problem.
this
Yes,
procedure.
yes. So depending upon your hypertension and diabetes, we recommend certain plans. We don't stop your medications also because we know how to balance that. And then once you get detox, your medication, I mean your sugar levels or your blood pressure is under normal level, then we suggest you that you speak with your doctor under whom you have been taking medicine, and if he tells you, okay, this is how you need to stop or change the medication or lower the dose, you follow that.
Okay.
Because at the end of the day, I personally believe that if any emergency lands up, you are the first person of your contact won't be me at any point of time.
Right.
It would be the allopathy doctor, because as a society we all have been seeing, okay, hospital लेके जाओ, इसको कुछ तो भी जरूर हो गया है. And there, if they tell कि बाबा ये दवाई थी, नहीं खा रहा था, they'll kill you.
Of
I mean,
course.
anybody would be that happy कि अरे you were told to have medication, why
Right,
did you stop on
right.
your own?
Right.
People in India do that. They feel हम डॉक्टर से बड़े हैं, but that shouldn't be the idea.
Self-medication.
Self-medication. Rather, I would say self mood के ऊपर लोग दवाई खाते हैं. आज मेरा मन नहीं था, मैंने दवाई नहीं खाई, भूल गया, मेरे काम में रह गया. We commonly hear all those kind of
Right.
things. So it's always good. The person who has started that is the person you should be
Consulting.
consulting and then stopping those medications. If not, then let it be. If there is something like the doctor is very adamant, then you can seek another advice and get it changed. But usually what happens is, once the doctor also sees that there are changes in his blood pressure or diabetes level, and they also tend to decrease the doses. They are not the ones who would be happy recommending too many pills to you
Correct.
also.
Correct. Makes sense.
So that way you need to be focusing on that. And if you are at a very early stage of, say, diabetes, blood pressure or something, Panchakarma ensures that it's reversed.
Oh, wow.
Yes. So like pre-diabetic condition, pre-hypertensive, there are many factors that lead to that. But if you do Panchakarma, if you follow a good lifestyle, there is no need. And even in allopathic books, it said that you can avoid these things unless and until it becomes a common thing कि भाई नहीं हो पा रहा है, then you need to take all these medications. Otherwise, even they prescribe, even they tell that you can avoid it in that sense.
When was your last Panchakarma done?
Recently,
Recent.
I guess in April, end of April.
Okay.
So at that time, I'm a good patient. I have to go under a doctor. He's a
Right.
senior practitioner. So I have to go under him. I do whatever he tells me. And for whole that 12 days, I got it done. I do it every year, no matter what.
Wonderful.
Except for the 2 years of COVID where we could not do it.
Right.
But I make it a point to get it done.
So, Dr. Rahul, one of the major problems that I feel a lot of people, whether they are the Gen Zs, whether the millennials, or the generations before them, are facing is stress. And I'm sure because of the rise in inflation and the kind of peer pressure or stress from the society or internal stress, there are a lot of health complications that have gone very high these days.
Very true.
And one of them being heart attacks, sudden heart attacks. So there are a lot of cases. I mean, I'm sure you are very well aware. Every other day we get to know कोई जिम में किसी को कार्डियक अरेस्ट हो गया,
Correct.
किसी को बैठे बैठे हो गया, कोई just ate something, and celebrities, recent news where a lot of celebrities, due to whatever reasons, they are ये sudden heart attacks. What is the entire concept here?
See, stress, I read a very beautiful definition. Stress is something where you are expecting something which you are not, or you don't need it. So उसका एक्सपेक्टेशन करना और वहाँ से सब कुछ एक चेन रिएक्शन जैसा होता है. So the reason being, like, everybody wants to get rich at a very young age. Okay, then you tend to work a lot, you do things and all. And these days people are forced to think, no, I need to become a celebrity by X age, or maybe I need to earn X amount by X age. So maturity ना बहुत जल्दी आ जाती है. I always give a very simple example in this. In today's world, if you see, children at the age of 10 or 12 are very much matured than what we were at that age.
Right.
Correct?
I agree.
You being a mom, you would be
Of course,
very
I
much
do.
agreeing on that. But kahin na kahin, we lost that childness. That childhood is lost of those children. And why the childhood is important, staying young is not by age. It's how you feel or how you do things.
Absolutely.
Okay. And जब वो बचपना चला जाता है ना और खेल कूदना चला जाता है, suddenly you start aging. Therefore, my point of view, one of them is that because we are aging so fast mentally, stress is becoming a very big factor, especially for people, for kids around 12, 14. I have seen 21-year-old coming and telling मेरी तो जिंदगी बर्बाद होगी, मेरा ये हो गया वो हो गया, and I am like, बॉस तेरा सुन के तो मुझे डिप्रेशन आ रहा है कि मैंने क्या किया लाइफ में. So somewhere unrealistic expectations having with yourself and by the peer pressure was society, Instagram and all those things is something that is creating a uneasiness inside you, or you can say a restlessness inside you. Now, what happens is in Ayurveda, there are concepts like Sattva inside your body, Atma, and Mana. Now, what happens is your mind or the Man is dependent or is the main controlling factor, but it is also controlled by the senses. Okay. So, whatever you see, whatever you touch, or whatever you perceive, वो आपके ज्ञानेंद्रिय, द 5 सेंसेस एंड 5 कर्मेंद्रिय, द फंक्शनल एस्पेक्ट्स ऑफ इट, उसके ऊपर उसके ऊपर से ये कंट्रोल होता है.
Okay.
सो इफ आई गेट अ स्टिमुलस, ऑब्वियसली माई माइंड विल से ओके मुझे ये चाहिए. लाइक if I give you 10,000 bucks, you will feel, oh good, मेरे को 10,000 rupees मिले. Then immediately the thought process will start, मैं इसको इन्वेस्ट करूंगी, खर्चा करूंगी, कुछ ना कुछ. So stimulus एक chain reaction जैसा create हो जाता है. Now all thanks to social media, everybody wants those things. I want this lifestyle, I want that. I have recently seen people buying toy cars worth rupees lakhs. And जबकि उसकी कोई वैल्यू नहीं है, just because they want to show off, or having those kind of sneakers and all those which are worth lakhs. It's not necessary.
Correct.
But then you create an unrealistic expectation for yourself and also for your family कि बस मुझे ये चाहिए, तुम ला के दो. And being these generation parents, you say नहीं नहीं बेटा तेरे को जो चाहिए I'll get it. So both of them are in stress. इसको चाहिए, इसके लिए स्ट्रेस है, और इसको खरीद के देना, इसके लिए स्ट्रेस है. Like you rightly said, inflation and all those things are going to create a pressure. Unless and until you have that good, it's not necessary.
Correct.
Correct. So if you have certain things, you can buy. There's no harm in buying. But if you don't have, then don't create those pressure unnecessarily. So what actually happens is these kind of pressures actually affect your gut. Okay. You must have heard about leaky gut and all those things recently. So basically what happens is when you have food, whatever, it's always said that while having food you need to be at a very peaceful place. You should not be having too much of television and all those kind of disturbances, because your whole focus should be on the digestion process itself. Similarly, when you are too stressed out or you are too anxious, or you can say even too depressed, the hunger goes for a toss. Okay, but still you are forced to eat. Like घर वाले बोलते नहीं नहीं बेटा खा, ये कर वो कर, but you're not that hungry and you still have it, then the first thing that affects is your gut. Because for the gut, or I won't say gut is equal to something in Ayurveda, but just to make you understand, it's more like the intestinal area. Correct. Okay, where everything would get digested as a final outcome. So आपका जो भी nourishment लेना है खाने में से, उसका जो मेन बाइफर्केशन होना है इनटू टॉक्सिन और वेस्ट मटेरियल एंड इनटू नरिशमेंट मटेरियल, दैट हैपेंस इन दिस इंटेस्टिनल एरिया. अब प्रॉब्लम क्या होती है कि जब आपका साइकोलॉजिकल बिगाड़ है, कुछ तो भी इश्यूज है, लाइक स्ट्रेस है, एंजाइटी है, डिप्रेशन है, दिस नरिशमेंट और दिस यू कैन से सेपरेशन डजंट हैपन इन अ प्रॉपर वे. ओके. सेकेंडली, in Ayurveda there is a concept called as Agni. Now Agni is something which will actually ensure that this separation takes place. जैसे हम घर में अगर आपने घी कभी बनाया हो, तो उसको हम पकाते हैं एंड देन दो सेपरेट चीजें बन जाती है. एक नीचे हम लोग उसको छिड्डी बोलते हैं पंजाबी में, एंड ऊपर घी तैयार हो जाता है. सो वो जो जैसे सेपरेशन होता है क्यूमुलेटिव में से, वो करने के लिए जो गैस की हीट है वो अग्नि रहती है. ये अग्नि मेजरली ये सारे एक्स्ट्रा चीज़ों से, मतलब आपकी लाइफस्टाइल से, आपके मेंटल स्टेटस से, और आपने क्या खाया क्या पिया है, आपकी प्रकृति क्या है, इसके ऊपर से it gets affected. Now, because it gets affected and you are still eating or forcing yourself, this separation won't happen in a proper way. And that would lead to creation of toxins, or what we call as ama in Ayurveda. Now, this toxin will now get circulated inside your body. मतलब जो clear water जाना था नरिशमेंट की तरह, वो अभी एक क्या बोलते हैं, खराब पानी की तरह बॉडी में जा रहा है, या टॉक्सिन्स के साथ जा रहा है. Now, this will create another chain reaction where you are on one hand you are stressed, anxious, and everything. At the second step, your gut took a toll, and on the third step, whatever nourishment is going, it's with toxins.
Right.
So it's not actual nourishment; it's like a slow poison going inside your body.
So,
And then, as a vicious circle that continues, slow and steadily, your mental state or mental well-being goes for a toss, and you start falling much more sick. इसके लिए डिप्रेशन या ओवर ईटिंग जो होता है डिप्रेशन के कारण, या फिर ये सब क्यों होता है? बिकॉज यू आर इन सर्च ऑफ दैट फील गुड हार्मोन, बट योर बॉडी इज नॉट एबल टू
produce that.
हाँ, प्रोड्यूस दैट, और आई वुड से justify the work that it has to do, and then all these toxins go inside your body and you are obese, or you get diabetic or something or the other,
Right, right.
or even blood pressure for that instance. And then it initially starts with sleepless nights, or too much thought process going on, you having an emotional ups and downs, and then suddenly you land up in what you known as either anxiety attacks, panic attacks, or depression kind of a scenario. But the whole problem lies in these three steps. Number one, your external environment. Number two, your gut and Agni. And thirdly, these toxins spreading inside your body.
Right.
So we need to focus on all these three aspects. It's not that giving a medicine is a solution, but you also need to focus how I can ensure that this problem is taken care by that person or maybe the family member. So it's a multifactorial thing. So what happens then once this toxins, sorry, I forgot in between. So once this toxins start circulating inside your body, it can go and lodge anywhere inside. It may go into the heart, it may go into your pancreas, and wherever it goes, it will create some other issues. So like you asked, okay, why these sudden heart attacks and everything is there? One of the reason is having this toxin. Second reason, which I have seen today, is majorly we call it as Udavarta technically, where your Vayu, which is naturally has a flow of starting from your nostrils, going inside your body from your nostrils and then being evacuated from your stools or the anus region. That's its natural flow. But if there is constipation, if there is certain aspects like you are sitting for a very long time, no exercise, nothing doing, then that gas tends to you usually find people saying I have a bloating issue or something.
Correct. Yeah.
If you don't take care of that, then next step is starts coming up. तो लोग बोलते हैं ना गैस चढ़ गई है, गैस चढ़ गई है, regurg kind of thing. Now that regurg, if you still don't take care of it, will someday cause an heart attack.
Oh.
Yes, and especially in celebrities, which what I feel is celebrities or people who are totally into too much of workaholic kind of a people, these people ignore this initial signs. उनको लगता है हाँ गैस हो गया, हो जाएगा, चेस्ट पेन होते रहता है, पीपल से हाँ ठीक है एसिडिटी होगी गैस होगी, बट दे ऑलवेज फॉरगेट दैट इन कार्डियोलॉजी और इमरजेंसी द फर्स्ट 20 minutes ऑफ अ chest pain is the golden period where you can survive. So I always recommend my patients, or even I tell laymen also, whenever you get a chest pain, first have ajwain and namak, say half teaspoon of ajwain, which is easily available at any home, and 2 to 3 pinches of salt. Chaba ke khana, chew it properly, and in 5 minutes, if you don't get 5% also relief, consider it as an heart attack and rush to the hospital rather than wasting time thinking that it's a gastric issue.
Oh.
So that way you can actually save yourself.
Correct.
Or even any family member for that instance. Because we think gastric है, हो जाएगा, और वो जब नहीं होता, then that person dies.
Of course.
Like last to last year, I lost 2-3 of my friends with cardiac arrest, and that too in sleep. at a young age of 38, 39 kind of.
My God.
So that's why I always say it's better to know certain things and do certain things and prevent somebody from dying,
Correct.
because it's a precious life.
Of course, doctor.
ठीक है?
So, doctor, are you trying to tell me that your gut health is can contribute to these cardiac arrests and the
Yes.
sudden heart
Yes.
attacks that we are seeing these days?
Definitely.
It has a
Very
link
big
to it.
effect. Very big effect. See, the gut. See, the gut comes from a very big term. Otherwise, we have something known as grahani in Ayurveda.
Okay.
And Ayurveda says that grahani is the most important part of your whole body. बाकी सब गया साइड में, तुम ग्रहणी को संभालो, बिकॉज वहाँ पे जो ग्रहणी है दैट हैज समथिंग नोन एज अग्नि विच रिसाइड्स विद इट, और द डाइजेस्टिव फ्लेम. Now these two, or rather than these two also, the digestive flame, the Agni, which is the boss, supreme boss of everything, has to be taken care, because it is the only reason for your living and it is the only reason for your death. So no matter what, take care of your digestion or your Agni.
Right.
ठीक है? If you your whole health, your whole immunity, your whole complexion, at the same time your whole vitality depends upon the simple Agni. If you don't take care, or if there is any fluctuation in its normal core, you will always fall, you will always have some of the other symptoms coming up. Why are these days so many people falling sick at a very young age with very grave diseases? Somewhere that Agni has taken a toll right during the conceiving
Oh,
part. That is where it all starts.
okay.
So, I mean, since I have my post-graduation into genetics, so I just happen to say that, but it starts with the food that the mother has during pregnancy. वहाँ से ये पूरी चेन आती है.
Yeah, I think these concepts like these genetics and epigenetics is one thing.
Epigenetics ही बात
So epigenetics is that crucially
Correct.
important in your
in your
health.
So that starts right from the during the pregnancy, whatever food the mother has. In Ayurveda, we call it as Garbhini Paricharya. And these days, many, you must have seen Garbha Sanskar and all those
Right,
things being
right,
happening.
yes.
We do take care of those kind of diets, and also just to ensure that the baby after a certain age also is normal, living a very healthy life. It's not just that pregnancy thing, it's birth and beyond actually.
Absolutely, yeah.
And similarly, having at what age you should be weaning, you should be breastfeeding, when you should be weaning, how you should be weaning, that also plays a very crucial role. Because this Agni, like I said, is the epigenetic area. The mother is responsible, but after the birth, for the first 1 year, whatever diet goes, that is responsible for ensuring that this grahani, or the most, I would say, the place where all the digestion is going to take place, building it up as a best potent part, is dependent on the first year of the child.
Oh,
So
okay.
therefore, those kind of diets or those kind of things has to be taken care, utmost care, because if you don't take care at that time, later on the kid will definitely have some or the other digestive issues. And therefore, you see childhood obesity a big problem these days.
Correct.
You see I have seen 8-year-old having gray hair, and a lot of gray hair,
Right.
which is very abnormal.
Right.
And not one, many. I have seen recently, I saw somewhere at the airport or somewhere, a 18, 19-year-old girl having as white as hair as mine. And that too a natural one.
Oh my God.
So this is how things happen. Like, you tend to see unnatural things coming at a very young age. So therefore, somewhere this Agni, this Grahani, or the gut, what is known as, is responsible for everything. So you need to take focus. So I always say you need to take care of the supreme boss, that is your Agni. Second, uska right hand jo hai, that is the gut. You need to take care of these two things. If you take care, 80 to 90% of your problems will be taken care.
Resolved. Correct.
It would be taken care. 10% is beyond my control or your control. It has some other factors into play. But at least you can take care of this. What is in your hand, you take care of that. That is how it would go.
So, Dr. Rahul, one of the problems that we are seeing these days and which is on the increase is we see every man is suffering from acidity and bloating.
Correct.
Okay, and what is the cause of this particular problem? Is it our food or the lifestyle that we are living, or is it the way we consume the food?
So, there are four aspects to this. Number one, what you are eating, how it's cooked, what are the core ingredients, and when you are eating it.
Hmm.
Like if you are having your meal at a proper time, when I say proper time, is when you are actually hungry, you should be eating at that time.
Okay.
That will ensure that it's a good digestion. Secondly, these days we have too much of either spicy food, or you can say a meal which is constituent of only one or two flavors or taste, I would say.
Hmm.
Like either you will have something only salt and savory, no sweet into that, or else you will have something very bitter, no other flavor into that. That is where it also hampers you. Number three, how it is cooked. Ready to eat foods, or you can say pre-cooked foods, just garam karke kha liya. All those things will again dampen your gut health as well as your digestion. And last importantly, what are the core ingredients that you are putting into it? Like a very simple example, if you see, uh, like today we all are very much crazy for Korean foods or
Right.
Chinese food and all those things. But our body doesn't know what to do about it.
Mm-hmm.
Okay. So therefore, autoimmune disorders are on a rise, because autoimmune disorder starts from your gut again, एंड देन योर बॉडी डजंट नो कि इसका करूँ क्या, इसको पचाऊँ, इसको फेंकूँ, इसका नरिशमेंट कैसे निकलेगा. सो जस्ट टू keep it aside, I'll give you a simple idea. Right from generations, we have a body which is set into certain processes कि ये खाया, इसका ये आउटकम है, और उसके कारण ये चीज़ें ग्रो होंगी या
Right.
बेटरमेंट होंगी. This has been passed since ages. Now, what happens is from one generation to the next generation, when these things are passed, the body knows okay, what I have to do about these things. Due to globalization and everything, all these things have now become a mix. Like हम इटालियन क्यूजीन भी खाते हैं, हम चाइनीज़ भी खाते हैं, हम इंडियन भी खाते हैं. एक दिन चाइनीज़ खा लिया, एक दिन इंडियन खा लिया, या मॉर्निंग में चाइनीज़ हो गया, रात को इंडियन खा लिया. All this kind of mixture, for the body it's very confusing.
Mm-hmm.
Because for the body, surviving is the main thing. Secondly, maintaining your health is the second primary goal. Then बाकी सब आता है उसके लिए.
Correct.
Now, when these two things are under, you can say, fire, that is where it starts doing certain abnormal activities, like creating inflammation in your body, or giving you body pains, fevers, and all those things. Or very simple, we have certain food stuff and then we get allergic, and then we either puke it out or we get loose motions, because the body has to throw it off. It cannot do anything for that, so it throws it off. That is where you need to understand that having these kind of food, especially in today's world when you have Korean food and all those things, your body may not be able to derive the nourishment that it wants from it. And then more of a waste material either will be created, or conversely, more of toxins will be circulated along with the nourishment. Whatever in this case happens, your body will take a toll. उसको जो चाहिए वो मिलेगा नहीं. So somewhere you would be eating a lot, still your body will be deprived of whatever it needs.
Correct.
To survive or to maintain your health. And then it starts giving signals. The first signal is bloating or gassy feeling. If you don't listen to it, you don't do anything about it, then slow and steadily it will give you a gastric burn or something. Even then you don't do anything about it, either you will puke out, or you will have some associated symptoms like migraine issues, having some kind of skin allergies or something. And then if you don't, then it will create something grave inside your body. So
Right.
it eventually builds up. But again, the food that you ate, how you ate, when you ate, what are the associated things, like you did not sleep well, you stayed awake late till in the morning, or people especially having night shifts, eating at 2 at the night when the body is supposed to sleep and take rest.
Rest. Yeah.
When you go against all these things, all these problems are going to happen, and these are very common. It's nothing that you or me won't be suffering, and at any point of time we tend to do all these things.
Right.
But if you want to get out of this, you'll have to break that pattern. Otherwise, this is going to create some other problem
Right. So, since we're talking about bloating and everything, one thing that comes to my mind is there's something, a new terminology that has come, which is leaky gut.
Correct.
What is leaky gut?
So basically, leaky gut is something where your gut has certain cells which are closely compact, and therefore any unwanted toxins doesn't enter your body. In leaky gut, what happens is this bridge or this compactness is open. थोड़ा रास्ते दरार आ जाती है. So
Okay.
these toxins tend to get inside your body or your circulation. So like I gave you an example of the toxins getting inside your body, this is what leaky gut says.
Okay.
Your toxins are going along with your nourishment, then it's going to create inflammation in the body, and any inflammation in the body will eventually lead to illness. So therefore, you must have heard about all those anti-inflammatory diets, gut benefit diets, and all those things. But basically, what they are trying to do is कि you need to just ensure कि ये जो leaking है ये बंद हो जाए, वो जो compactness है वो आ जाए. It's very difficult to prove that this happens. It's actually a hypothetical concept that has been put forth by allopaths. But if you look at the physiological aspect, it happens. Like I gave you the very starting, allopathy and Ayurveda, why do they differ?
Right.
It's only because of this. There are certain things which cannot be proved by microscope or anything right now. Maybe they might create some or the other machine which might prove this thing. But again, why to spend so much when you can actually get an answer for that?
Right.
So that is where we differ. So in Ayurveda, where mentioning physiology, all these things are like, okay, this is going to happen. But anatomically or on the microscope, it's very difficult to prove it.
Makes
ऐसे.
sense. And doctor, now as we mentioned, your diets and what you eat also has an impact on how your gut performs.
Correct.
So, what is the impact of dairy products or dairy food on your gut health?
So in terms of dairy products, a cow milk is the best thing that you need to have, or overall milk, I would say. But all the other byproducts like curds, paneer, or cheese and all, they have to be consumed in very cautiously. And not
Oh.
everybody should be consuming it.
Okay.
Okay. Milk is something like cow milk is something that is good for everybody, no matter what. Uh, for cancer patients, we keep them only on milk diet, no food, only milk, and that too in 2 liters, 3 liters quantity
A day.
a day. Baki kuch nahi, no salt, no sugar, nothing, only milk. That ensures your body's metabolism and all those kind of things are taken care, and the metabolism comes back to its normal place. But if you see, dairy products especially, paneer is very heavy to digest. If you see, it's हम उसको दूध को फाड़ते हैं and then
Correct.
उसको कॉटेज चीज बना के हम खाते हैं. So again वो डाइजेशन के लिए हेवी होने वाला है. चीज़ इज समथिंग, ये कॉटेज चीज़ को आपने फर्मेंट करने के लिए छोड़ दिया फॉर अ ईयर और समथिंग, देन द चीज़ इज फॉर्म्ड. अगेन हैविंग इट इन इंडिया इज़ बैड. इटली एंड वहाँ पे खाओ इट्स ओके बिकॉज वहाँ का क्लाइमेट उसके लिए सूटेबल है. इवन इफ यू गो टू द द हिमालयन रीजन, there are many such processes where they ferment this milk and they make cheese out of it, क्योंकि वहाँ पे कुछ उगता नहीं है, नेचुरल वेजिटेशन नहीं है, प्लस वहाँ का क्लाइमेट वैसा है कि वहाँ वो डाइजेस्ट हो जाएगा. आप जितना नीचे आ जाओगे इंडिया में, प्लेटो एरिया एंड सदर्न रीजन में, वहाँ उतना ही वो हैम्पर होते जाता है, वो खाने लायक नहीं बचता है. सो आई ऑलवेज से वेर यू आर लोकेटेड, वहाँ का लोकल कुजीन को पहले समझो. वहाँ से आपको सारे आंसर्स मिल जाएंगे, आपने क्या खाना है क्या नहीं खाना है. लाइक व्हेन यू स्टे इन महाराष्ट्र और इन मुंबई, सो वहाँ का लोकल खाना देखो, वो क्या होता है, रोटी सब्जी दाल चावल, एक कोशंबीर बोलते हैं, छोटी सी इसमें सैलड दही डाल के देते हैं, बस उसके ऊपर कुछ नहीं होता है. वही आप नॉर्थ इंडिया चले जाओ, वहाँ पे आपको अच्छी खासी सब्जी दाल दही पराठा ये सब मिलेगा. वहाँ वो खाया भी जाता है. लोग बोलते हैं हम नॉर्थ जाते हैं तो बहुत खाया जाता है.
Correct.
कुछ नहीं होता है, क्योंकि वहाँ का ज्योग्राफिकल क्लाइमेट एंड नेचर उसको
Support.
सपोर्टिव है. आप बॉम्बे में खाओगे नहीं सपोर्ट करेगा. इसके लिए बॉम्बे जैसी जगह पे दही खाना आपकी स्किन प्रॉब्लम्स का बहुत बड़ा फैक्टर है. आपकी स्किन प्रॉब्लम्स एग्रीवेट हो जाती हैं. वही चीज़ आप नॉर्थ इंडिया में जाके खाओ, स्पेशली जम्मू उस साइड में, नहीं प्रॉब्लम देगा आपको, क्योंकि वहाँ के क्लाइमेट के लिए वो ज़रूरी है. वहाँ पे सस्टेन करने के लिए उसकी ज़रूरत है। सो इसके लिए हर चीज़ हर जगह सूटेबल हो ऐसा नहीं है, आपको स्लो एंड स्टडीली लोकलाइज होना ही पड़ता है। I'll give you a very interesting thing. I knew somebody, a family friend of ours. His daughter got married to she was a Jain. She got married to a Gujarati person, but in France, Paris में.
Okay.
And they both of them stay in France. अब वहाँ फ्रांस जाके पेरिस जाके उसको फिश खाने का चस्का लग गया.
Okay.
And then she started having fish left, right and center. Okay. And इतना के people used to say, "Bhai, are you really Jain kind of a
Jain having
person,
fish.
fish and all those things?" And she said, "I don't need anything. I love fish and I'm happy with it." This girl slow and steadily started having these gastric issues and everything, but she did not give up on fish. Okay, and then she came to India. इंडिया आके भी उसने उतना ही फिश खाया. बॉम्बे तक थी तो इतना कुछ प्रॉब्लम नहीं हुआ. शी शिफ्टेड टू दिल्ली, समवेयर इन दिल्ली, गुड़गांव सॉरी. वहाँ पे भी उसने उतनी ही फिश खाई. वहाँ जाके उसको जो फिश ने साइड इफेक्ट्स दिखाए ना उसके, देन शी स्टार्टेड टू अंडरस्टैंड कि नो आई नीड टू लीव फिश. सो you can say after suffering for almost 2 or 3 years with very bad skin issues, psoriasis and all those oozing eczema and all,
Oh my God.
she eventually left it. कि भाई अभी छोड़ दूँ. And when she left it, in the next 3 years she got better also. क्योंकि वो एक तो उसकी बॉडी को सूटेड नहीं था, कभी उसके जीन्स में उसके लिए कुछ था नहीं, उसने तो खा ही लिया, प्लस उसको प्रॉब्लम हुआ. इवन हर किड हैड अ वेरी बैड स्किन इश्यूज राइट फ्रॉम बर्थ उसको एक्जिमा था बेबी को.
Because your diet, your genes also play a role
Yes,
in your
they
diet,
do.
whether they can adapt to it or
To
not
it or
adapt
not,
to it.
correct. They have to adapt to it. Otherwise, it's very difficult for the body to do anything.
Okay.
So, genes is very, I would say, a big term, but your body needs that adaptation. कि भाई इसका करूँ क्या, मुझे वो तो बता दो. It needs that answer to its question कि what next, what to
Correct.
do about it. And therefore, your diet and everything plays a very, very important role. And leaky gut is something where these things are now trying to be understood. So there is a new branch of allopathy which is known as functional medicine.
Okay.
After seeing Ayurveda grow, now they also said कि हम भी कुछ कर लेते हैं physiologically. So they created something as functional medicine. There they speak about all these things. What we have been speaking since ages, कि boss, you need to see about the physiology also. It's not only the anatomy that you need to take care about, it's the physiology also in that way.
So here, contradictory to many beliefs that we layman or we general population has, you said dahi or yogurt uh, is not very good for your health and it should be consumed in minimum quantities. Contradictory to our belief that dahi or yogurt is a prebiotic or a probiotic, which helps in digestion.
Correct.
Okay, and also dahi being something that goes and eases the digestion process and should be highly consumed in summers as compared to winters. But you are saying that dahi should be consumed in regions like Kashmir where it is perennially very cold.
Yes.
So what is this contradiction? Something that we really need an explanation on.
So, curd as such, it's cold on touch, but on digestion, it's heaty in nature.
Oh, okay.
गर्म होती है, उसकी तहसीब जो रहती है वो गर्म होती है.
Okay.
So therefore, having it in areas like Bombay or you can say anywhere in the southern part, it's not a feasible thing. Again, just leave apart certain areas like Kerala and this Kerala majorly, where and Tamil Nadu, the coastal belt of Tamil Nadu, there you can have. Again, the geographical location matters a lot. So दही का कैसे है, दही being very hot in nature on digestion will actually lead to acidity in a longer run, and that acidity would be like a molten lava kind of a thing. Choco lava cake देखा होगा, the moment you scoop, everything sticky and runny comes out. Similarly, with curd, the acid that would form inside your body would be sticky and runny in nature, and therefore it has to be taken care that you don't have too much of curd overall. Again, curd is good in winters and not in summers, क्योंकि गर्म होता है तो ठंडी में उसकी ज़्यादा ज़रूरत है. People who have too much of curd, usually land up in either having nasal bleeding or anal bleeding and all those kind of problems, or even in women I have seen having metrorrhagia or too much of heavy flow during the periods and all.
Mm.
You need to cut down on that curd. Now coming to the probiotic prebiotic part, it's a very interesting thing. Like they have tried to classify कि ये इसके लिए अच्छा हो उसके लिए अच्छा. It's like asking the whole cricket team to play as an individual player कि तुम यही करोगे बाकी कुछ नहीं करोगे, तुम्हारे पास बॉल आया तो ही तुम्हारा काम है, नहीं तो तुम काम के नहीं हो. ऐसा नहीं होता. When you play cricket, it's the team effort that goes into
course.
play. So similarly, prebiotics, if you see, today they say turmeric is there, ginger is there and all those things. हमारे जो खाने में इंडियन क्यूजीन के जो मसाले हैं, सुक्का मसाला हो या गरम मसाला हो, वो सब प्रीबायोटिक कैटेगरी में एक्चुअली आ जाता है. So prebiotic actually ensures that whatever you are going to eat is going to get digested properly. So उसको प्री तैयारी करके देना वो उसका काम है. बट एट द सेम टाइम प्रोबायोटिक्स जो रहते हैं वो रहते हैं कि कभी खाना खा के हो गया, उसको पचाना कैसे, उसका काम करना है. सो चीज़ कैसे है कि लोग बोलते हैं कि छाछ पी लो या फिर कर्ड खा लो तो प्रीबायोटिक प्रोबायोटिक का काम करेगा, बट नॉट नेसेसरीली. हर बार वो करे ही वैसा नहीं है, और हर एक को सूट हो अगेन वो नहीं है. सूट क्या होता है पता है? इंटरेस्टिंग है ये. पान,
Oh, okay.
जो हम वो मीठा पान खाते हैं ना, पर वैसे उसमें वो इतना क्या बोलते हैं, you don't have to put all those gulkand and all. If you go to a South Indian restaurant, Shetty Hotel in Mumbai, they give you something which has just coconut, little bit of katha and थोड़ा बहुत वो sweet डालते हैं just for flavor. तो वो वाला जो पान होता है ना, that is good for you.
Betel leaves,
Betel
basically.
leaves. So at the end of the food, having betel leaf or chewing betel leaf with very little supari is necessary. That actually is a probiotic.
Okay.
क्योंकि जो भी कुछ खाया है अब उसका अच्छे से डाइजेशन होना बहुत ज़रूरी है. वो इट शुड नॉट बी हैवी इन नेचर, ताकि जो खाना गया है उसको भी हैम्पर ना करे डाइजेशन में. एट द सेम टाइम इट शुड बी एनहांसिंग और कैटलाइज वर्क एज अ कैटलिस्ट टू इम्प्रूव द डाइजेशन. सो इसके लिए वो पान बहुत बड़ा चीज़ है, और इसी के लिए लोग पहले पान खाते थे.
Correct.
ठीक है,
it
खाना
was a
खाने
part
के
of our
पार्ट ऑफ अ
culture.
कल्चर, एंड इट ऑलवेज यूज्ड टू बी आफ्टर योर मील्स.
Correct, yes.
आफ्टर यू हैव डन ईटिंग पान खाते थे. उसकी फिर वो क्या बोलते हैं, लोगों ने उसका मिस यूज करना और वो सब अलग हो गया. But
Varieties
actually
बढ़ा दी. They
बढ़ा
started
दी.
adding tobacco
Tobacco
to
and
it.
everything, because then you feel that kick and all those
Right.
kind of things. But otherwise the whole idea was very simple. It has to aid your digestion. So वो एड जो करना है वो पान करके देता है. राइट. सो आई ऑलवेज से हैव अ पान, अ सिंपल पान विद वेरी लिटिल दोस टूटी फ्रूटी एंड ऑल, और थोड़ा सा खोबरा, कत्था हल्का सा, और वो डाल के बस खा लो, और ऊपर लवंग लगा के या इलायची लवंग डाल के खा लो. दैट्स इट. उसके ऊपर कुछ नहीं करना है. तो तुम्हारा ये जो प्रोबायोटिक और ये सब है वो कंसेप्ट उधर खत्म हो जाता है.
So these fancy terms and the fancy products that we see in the market,
हाँ,
you know,
like the probiotic drinks
the
and all,
probiotic
they're not
drinks
good.
and
They're not good. See, if you really have something big inside you, जिसके कारण वो थोड़ा बहुत ठीक हो सकता है, it's a temporary fixation.
okay.
It won't cure you forever. And secondly, uh, I would say 1 in 1,000 might be actually needing it. Rest 999 are not, are
They don't
totally, they
require
don't
it.
require it.
It doesn't have to be a part of your daily diet.
Not at all, not at all. हाँ, अभी कैसे इसमें थोड़ा लोकेशन, जोग्राफिकल लोकेशन में चेंज आता है. लाइक इफ यू गो टू सौराष्ट्र, वहाँ पे छाछ पीने की ट्रेडिशन है.
Right.
बट इफ यू लुक एट एक्चुअल सौराष्ट्र का क्लाइमेटिक कंडीशन, इट्स ऑलवेज ड्राई. वहाँ पे पहले पानी नहीं था, अभी तो चलो वो कैनल्स आ गए तो सब गड़बड़ हो गई है. बट अदरवाइज इफ यू ट्रेडिशनली लुक, इट्स अ वन एंड इट्स अ कोस्ट, वन एंड इट्स अ एरिड ड्राई लैंड. तो वहाँ पे छाछ ज़रूरी है. सिमिलरली केरला जाओगे, वहाँ पे हर तरफ पानी है, तो पानी की अल्कलाइनिटी को मैनेज करने के लिए दही, वो कर्ड राइस खाते हैं, सो दैट वो एसिडिक मिले बॉडी को, ज़रूरी है. आप नॉर्थ इंडिया जाओ, वहाँ पे पहले ना ये जैसे पान का जो ट्रेडिशन है वो नॉर्थ इंडिया में ज़्यादा है, क्योंकि वहाँ पे पानी है ही नहीं, वहाँ पे सब ड्राई एरिया है, तो वहाँ पे पान चाहिए. सो डिपेंडिंग अपॉन वो चीज व्हाट इज वेयर रिक्वायर्ड, हमारे ट्रेडिशंस बने हैं, डाइट पैटर्न्स बने हैं. हर जगह का डाइट आप हर जगह फॉलो नहीं कर
नहीं कर
सकते हो।
सकते, करेक्ट।
लाइक आप नॉर्थ इंडिया का डाइट आप बॉम्बे में या किधर और फॉलो नहीं कर सकोगे। सिमिलरली आप बॉम्बे का डाइट नॉर्थ इंडिया में फॉलो करोगे, आप भूखे ही मर जाओगे। सो वो जो चेंज है, जोग्राफिकल चेंज, वो आपको उतना ही इम्पोर्टेंट है। एंड therefore these days many dietitians say कि ओके ईट लोकल, ईट दिस एंड दैट। वो पहले से ही था, क्योंकि हम पागलपन करने बैठे, वो लोग कुछ नहीं कर रहे हैं। So in Ayurveda, there is a concept of Satmya Satmya. What is good for your body and known to your body, and what is unknown to your body. So it is very interesting because it is said that when you go from one place to another or migrate from one place to another, at that time you need to change your diet to the local conditions.
Right.
But it should not happen immediately. It should be a
Gradually.
eventual process of at least 2 years, 3 years kind of a thing.
Okay.
जब आपको पता है आप उधर ही सेटल होने वाले हो, that is where you need to go into that. इसमें थोड़े बहुत चेंजेस हैं, लाइक सडनली प्लेसेस लाइक दुबई और द गल्फ हैव एमर्ज्ड, जहाँ पे पहले सिर्फ रेगिस्तान था, फिर वहाँ पे जाके कुछ उगता तो है नहीं, वैसे ही सब बाहर से आता है। सो लोकल वैरायटी तो कुछ रही नहीं। सो दैट टाइम टेक इंडियन फूड ओनली, बट देन उस रीजन को पकड़ के तुम्हारा डाइट क्या होना चाहिए, यू शुड बी
You'll have to
थिंकिंग एंड इनकॉर्पोरेटिंग,
modify it
मॉडिफाई एंड डू
accordingly.
थिंग्स ऐसे।
So, Doctor, my last question on gut health before we move on to the next topic is we see a lot of men who are workaholics or who are, as we say, men are the providers, and in that conquest of fulfilling their roles as providers, they've been doing a lot of experimentation with their food.
Correct.
Especially if you see a lot of bachelors who've migrated to another part of the city, country, or and do not have fresh food available.
Correct.
Again, their lifestyles is an issue because they are working maybe night shifts or night shoots or multiple things like that. What would be your tips for men like this who are completely absorbed by their work, who do not have fresh food available and are excessively dependent on food from the
Outside.
like the shops or restaurants or local vendors?
Correct.
What would be your tips for them for good gut health or physical
Overall health.
Overall health.
So, like every doctor, we say no alcohol, no smoke. That is most crucial because these are the two which actually hampers each and every aspect of your health. So,
Right.
therefore, no alcohol, no smoking. Thirdly, I would say less of white things like sugar, maida, and all those stuff. But like you rightly said, they are going to eat outside.
Right.
Restaurant है या जो भी मिला वो खा लेते हैं. So उसमें just avoid ready to eat kind of food. Thirdly, all you can do is, even like if you're having a bread for that instance or a sandwich or something, ensure that the bread is toasted because a fresh bread won't harm you that much the way a stale bread would harm you. So for a bachelor, bread is something like a bread, the real food that they
It's the
have.
everyday food. for
Everyday
them.
food. So you can just toast the bread or even pav that for that instance, उसको गरम करके खाओ, कच्चा मत खाओ kind of thing. Thirdly, I would also recommend them that if they are having night shifts, so don't have anything after 8 o'clock in the night. रात को जब 2 बजे 3 बजे जो खाते हैं ना कि भाई अभी कुछ तो चाहिए, that is where they start falling sick. At that time you can have a cup of milk. कुछ नहीं तो थोड़ा सा just very little सेव ममरा गुजराती में बोलते हैं, सेव एंड कुरमुरा थोड़ा खा लिया, बट पूरा पेट भर के नहीं खाना है. हाँ, बट उस टाइम पे अगर तुमने चॉकलेट्स खाई, नॉनवेज खाया या फिर ये मैगी वगैरह खाना,
Chinese is known as the midnight food.
yes, वो तो फिर you are going to fall sick for sure because that won't be the body won't be able to digest because
Correct.
for it it's the resting time.
Right.
It's not the working time. तुम उन लोगों की तरह जाग रहे हो, वो बेचारी तुम्हारे बीच में पिस रही है. So for it has to take rest. Therefore it's necessary for you to actually give it a rest in terms of food also. So for night shift people, I always recommend that whenever you come back home in the morning, just have a what you can say, a massage with regular sesame oil or coconut oil. Have a cup of have bath, then have a cup of milk, and then go to bed. Most of the people, they come, they freshen up, and then they eat, and then they go to sleep. Your gut is going to take a toll. So you don't need to eat before you sleep. You need to eat after you wake up,
Correct.
and that is most crucial in all these people, for especially the night shifters. technically speaking, I can't ask them to leave their job.
Of course.
Obviously, they cannot do that. But yes, all they can do is they make this twist in their lifestyle. Things would be much better. They would fall sick, but comparatively, the intensity would be very less than what would happen if they don't follow it.
Right.
So in Germany, there is an interesting fact where you cannot have a stale bread or you cannot sell a stale bread. So आज का बना आज शाम तक ही finish off करना रहता है, and which is actually very good thing because breads or all these bakery products, cookies and something, if you have it freshly baked and you consume it the same day or maybe within next 2 hours, there is no harm, less harm I would say. Even though it has maida and all those things, refined flour, still it would be a much better option rather than having it stale. In India, what happens is they produce it today. You will find it, the bread especially, you will find it in the grocery shop the next day with the expiry date of next 3-4 days.
Right.
So therefore, it's very, I mean, when you have those kind of things, you'll always get digestion issues. So have whatever is hot and freshly prepared. So I guess there was a nursery rhyme in childhood, hot cross bun,
Right,
1 penny,
yes.
2 penny, hot cross buns. So why hot cross buns? Because freshly prepared, freshly eaten.
Right.
If you do those kind of things, even a bread won't trouble you that much. But you need to ensure that it's a freshly prepared and freshly consumed. So especially if you are a bachelor or something and you know a bakery where you will get it very freshly prepared, just have it, take small portion and have it. Don't rely on the grocery stores के
Correct.
आएगी bread फिर खाएंगे. Take it from a bakery, have it. Or in that case, even if it's a pav or something, freshly prepared, just toast it a little more, have it. That's all you can do, at least as a bachelor.
Correct.
But anything that is ready to cook or pre-cooked, just ready to heat kind of things, avoid it at any cost. It's going to trouble you. And therefore, you find these problems much more in American people or European people because they have too much of ready-to-eat food or just preheat
Quick
kind of
food.
food. And there, the gastrointestinal cancers are at a very high rate.
Right.
Again, everything is linked to that gut.
Correct.
So you need to take care of that.
So, Dr. Rahul, moving towards a very important topic of our podcast today, there's a lot of stigma around one topic, which is men's sexual health.
Okay.
There are many men who face problems like ED, which is erectile dysfunction, and PE, which is premature ejaculation. So, according to you, and they're equally embarrassed to talk about it.
Very true.
According to Ayurveda, what are the common roots or root causes, in fact, of these problems?
So for both of them, actually, it starts with P or premature ejaculation that might eventually lead to erectile dysfunction. The common thing both of them have is either there's a psychological issue of either stress, anxiety, performance issues, or maybe people having certain notions like because of the exposure to porn and all those things, people feel that they should be lasting for a very long time, whereas the average timing for India or the Indians is very small compared to the other Africans and all those things. But an average time of 7 to 10 minutes is an ideal time which one should be thinking. Again, the problem comes down that those people who don't perform more than a minute or maximum 3 minutes, they are categorized into premature ejaculation or as such. And one of the causes that causes it is starting with the stress factor. So most of the time it is said that the sex is not between two legs, it's between 2 ears. So what you are thinking, what's going on inside your head matters a lot. Even the women as well as for the men. So if the person is in a different thought process, he's in his stress, but he's just performing because he wants to release his stress, then definitely premature ejaculation would happen. On the contrary, even if he has eaten a lot, he's obese, he has certain conditions inside us like diabetes and all those things, definitely he will have a performance issue. So again, the food becomes a very crucial part and the exercise becomes a crucial part in ensuring that the premature ejaculation doesn't occur. Now you would be thinking why exercise comes into play. because exercise is something that will ensure that all the serotonin and oxytocin, kind of the good happy hormones, are released inside your body. So depending upon your constitution, you need to be working out. Like if you are a heavy built person, doing yoga won't help you. Okay, it would just calm you for sure, but it won't help you in terms of an exercise for the body. It would just act as a calming thing. So for those kind of people, having workouts like going to gym, swimming, exercising a lot, or maybe doing Surya Namaskar and all those kind of rigorous physical movements would ensure that they won't land up in all these problems.
Okay.
Similarly, a person who is very thin built and he doing gym will trouble him.
Right.
For him, having yoga or the simpler form of exercise would be recommended. So again, your diet, and to that you need to add to your diet. Now, the diet doesn't mean having fancy things like anjeer kha lo, musli pak kha lo, ye kha lo. Whatever you are eating has to be in sync with your constitution and is to be sync with where you are living and the season that you are having. If you follow this, it's very easy to have a good sexual life. Now, this PE or the premature ejaculation over a period of time, plus with many other factors, gets converted into erectile dysfunction. Now, erectile dysfunction may also occur with or without a premature ejaculation. But in those cases, it's usually the predisposing metabolic conditions which actually cause that dysfunction. For a person who's having dysfunctions, it's very important to get the root cause treated. If he doesn't do, it will lead him to a very bad self confidence. He may
Right.
land up in depression or have a very bad marital issues, because uh, for any kind of a bonding, especially in between a male and a female, as a husband and wife or as a partner, sexual bond is much more important. I always say, when you are as a couple, if you don't have a sexual life, you are going to have a ruined future.
Correct.
It is more important, and it doesn't mean having like वो porn की तरह दिन भर करते रह रहे हैं. Even though it's once in a week or something, that intercourse is the one that keeps the relationship going. So therefore, for them to ensure that this relationship is fine from both the ends, it is very necessary to get these things treated. Uh, what people think is that I need to find a quick fix rather than
Correct.
speaking with somebody. That won't ever solve the problem. Even if you go to a doctor or a therapist or something, unless and until you speak to them, you won't find a solution. Because, like I said before, it's majorly a mind game at times.
Mhm.
You need to just verify whether it's really a mind game or it's a really a metabolic disorder or some problem, a medical problem that you need to get resolved. So that person, the doctor or the therapist, would be the one guiding you or bifurcating your path. Okay, if it's a psychological thing, just a phobia or something, that person would be the one who would actually be helpful. But
Right.
if it's a medical condition, then you need medications and doing those
Correct.
stuff. So it's always necessary to speak up
Right.
with somebody at least to get an idea.
True. Also, Doctor, the healthcare industry or the
Mhm.
health markets are filled with, as you mentioned, these quick fixes. There are a couple of tablets available, oils available, and
Correct.
multiple things that men resort to in
Correct.
order to kind of have their problems
Problems.
resolved. I want to understand from you, what are the long-term dangers or implications of these quick fixes? And if a person doesn't resort to all these things, what are the naturally available solutions to his problem?
Uh, if you are speaking of quick fixes in terms of allopathic medicines like Viagra and all, they are always harmful. Like tadalafil and sildenafil and all those things, which are known as commonly Viagras and all, they are going to be a very big problem for you because they increase your heart rate, they shoot your BP, and then you may suddenly land into a cardiac arrest or something.
Right.
So unless and until a doctor prescribes you, maybe a sexologist doctor, but or an endocrinologist, until and unless he prescribes it to you, you should not be getting into all those things. At any medical shop, it's very easy. The pharmacist just tell them, "आप ले लो, कुछ नहीं होता है," and all those things. But it should never be done because these medicines can kill you at any point of time. क्योंकि आपका हार्ट रेट जो है नेचुरली बढ़ता है ड्यूरिंग सेक्सुअल परफॉर्मेंस, एंड ऊपर से दवाई ली है तो और ज़्यादा बूस्ट अप होगा. सडनली दे माइट बी अ हार्ट अटैक. सो देयरफॉर इट्स नेसेसरी टू ensure that it's taken under medical supervision. In terms of Ayurveda quick fixes, which are usually seen on TVs as an advertisement and all, these don't act as fast as a Viagra would act, but still they would give a similar kind of effect. But again, this would be just a performance-based kind of a medicine. It won't be a permanent cure for their whole problem.
Right.
But the sad part is people feel कि मेरा आज का काम तो हो गया, तो ये चल जाएगा. And then what happens is eventually taking from basic medicine to the more higher, and then when they reach a point in life where they are say somewhere around 50, 60, and then अभी किसी से कुछ नहीं हो रहा है, then what to do, what's next? That is when they think, okay, I should speak with somebody. But it's eventually too late for them to actually get results.
Right.
So therefore, it's necessary to understand your problem, consult a doctor on time, get it checked, and you can say treated at a proper time so that at a later stage you are not suffering from them. Whether it's harmful or useful for the body, it's again, especially with the Ayurveda, I would say it's not that harmful, but yes, it's not a permanent solution.
Correct.
These days, Shilajit is being promoted a lot. So actually, Shilajit, if you see a textual literature, it has very less to do with the actual sexual issues. It has more to do with the, you can say, diabetes, what's so-called diabetes, or wherever the body has become too lethargic. That is where it actually works. It won't work for somebody who's working out the whole day, having a good body, maintaining a good lifestyle. It would be a waste for him. Somebody who's totally lethargic, not doing anything, now he's having diabetes or some grave condition, and he has this sexual issue. For them, it might be a solution. But again, the way people consume these days, like a natural resin or something, that is not it is how it should be. We call it as Shodhan Prakriya in Ayurveda. So Ras Shastra is a mineral section of Ayurveda where they tell you how to have minerals like gold, silver for the body, which can be consumed by the body. So there is Shodhan Prakriya. Without that Shodhan Prakriya, having resins won't ever solve the problem. And if you go to the the pharmaceutical way of making those things, it would be a loss for them because they cannot sell it at that cheaper price because it's after this detoxification or the Shodhan process of that Shilajit, it would be a very small portion that is left out. So therefore, what you get in market may or may not be actually useful for you overall. So if you are having it, take it from an Ayurveda doctor or from somebody who's into Ayurveda and who you know that he has done this detoxification process, then only it's useful.
Would you recommend some sort of dietary changes or dietary inclusions that can help men with the problems here?
Milk is something that would help them instantly.
Okay.
Like, you must have seen those Hindi picture.
Right.
First night के दिन
The
दूध
very-
रखते हैं and
जी.
all. So उसका एक पीछे reason है. Milk is something that instantly increases your sperms
Okay.
in quantity wise. Okay. And it's always said that the sexual union should always happen with considering having a child in mind. कि मुझे बच्चा करना है. So just a deviation from the topic, something people say is like brahmacharya. It should be followed. Celibacy should be followed. But actually in Ayurveda, the celibacy has a different aspect. It is said that it should not be for pleasure. You should have sexual intercourse for baby. So when for progeny, if you are having it, that is where the sexual intercourse should be there, and in moderation and everything. There are rules and regulations for that. And for all these aspects, that milk becomes a crucial part because it will instantly increase the quantity of sperms, the chances of getting pregnancy increases, and later on all those kesar and all those kind of stuff, they do add on to boost that process. So if anybody looks for a quick fix, milk is something that they should be having more. Again, milk has its own rules and regulations. The ideal time to have milk is in the morning hours rather than going to bed. You can have milk at night only if you had your dinner at around 6 o'clock in the morning, evening, and you are having your sleep at around 10:30. That is where you can have milk at night. You cannot have you cannot have your dinner at 9 o'clock and milk at 10 o'clock. It will always create a problem. So that way, milk is something that is very much beneficial. Uh, Also, uh, in dietary terms, use of raisins, black raisins, uh, figs and apricots, dried figs and apricots is a good thing. That would be good for the sexual health overall. Anything apart from that, which has more like rice, wheat, they are again good for your sperms or your sexual health. Having more of millets is actually bad for your sexual health.
Oh,
It's good unless and until you have a pre-diabetic and all those conditions. So you are able to overcome that challenge. But if you speak of nourishment, it's not good for your body. So millets, it's good when you have conditions and then you can reduce your problem, and then this performance and all this things are taken care. But once you get back to your normal, you have to balance between the both.
right.
In that.
And doctor, since we've been speaking a lot about gut health and how gut health has a lot of impact on the various illnesses or the various organs of your body, gut health is also linked to sexual performance and all.
Yes, it has a direct link.
Okay.
And like I said, all the nourishment and everything is from the gut.
Hmm.
So you need to take care of your gut. The moment anything abnormal happens in the gut, the resultant changes would be experienced in your sexual health also. And what happens is with those toxins, when they get to a deeper tissues like the sperms and everything, initially it starts with like having some kind of pain or discoloration in discharge, or maybe less of sperms, abnormal sperm count, those kind of problems. Or even at times they may even have erectile dysfunction due to their dietary issues. But once you resolve that, only then it will be taken. So again, while resolving that, your gut has to be taken into consideration. The treatment has to be there on the gut. Only then it would be taken. It would ensure
Show
that the
results.
treatment is complete.
Correct. Thank you so much for throwing light on this very crucial topic, which usually is not considered a favorable topic that people want to discuss. But this gets me to another topic that I wanted to discuss. One of the biggest problems that men face these days is baldness.
Hmm.
These are two such topics that men are really concerned about and are embarrassed to talk to people about, but they definitely and they desperately need solutions for. What is your take on this?
So there is something known as androgenic baldness, which is due to the change in the androgen hormone inside the body, excess production that leads to baldness and all. So in those cases, again, your diet, lifestyle plays a role. There are chances of it coming back. I mean, you can reverse that androgenic baldness and all. Okay, but at a certain age, say around 50, after 50, men are supposed to lose hair. So the baldness after 50, or you can say 60, is a natural phenomena. Ideally, there is one Samhita known as Sharangdar Samhita, where after each age, what happens, what you lose inside your body, it is mentioned. So after 60, your hairs are bound to you. You're supposed to get bald overall. When you get bald at a very young age, say 18, 20, at that time, it's usually the high heat or the pitta inside your body which actually creates this. So that heat will actually disturb the normal functioning of the hormone, which will ensure you will get baldness and all those kind of things. And if you don't treat that pit, it will eventually lead to complete baldness of yours. So for that, you need to change your lifestyle, less of spices and all those kind of things. And accordingly, the treatments happen, like how I said about the Panchakarma, detoxification and all. Then slow and steadily you will have your hair back. But there are times where all these things won't give you the results that you are seeing out. Maybe these days all those hair transplants and all maybe a quick fix, but still it's a solution that these people have. Because at the end of the day, your looks matter.
Correct.
And since your looks matter, so that confidence is also it's dependent upon that. So therefore, for that, maybe you can go for these kind of treatments. But yes, if you want to if you want to go something for natural, you need to change your lifestyle and your diet. Otherwise, you won't have a solution for that.
Since you spoke about lifestyle and diet, and we very well know that you're an expert in lifestyle programs, could you help us with 5 tips as such, or 5 recommendations which people should follow or should not follow in order to have a good lifestyle?
Okay, so we'll start with the external things which we encounter. So constant AC, sitting in an AC environment is not recommended at all. Let it be India, let it be anywhere, let it be pollution outside. You cannot sit inside an AC for a long time. So all this ACs and all, say humidifiers, ACs came from certain things known as ergonomics. So ergonomic is where, as a productivity, you need to make changes inside your environment so that you can work much more longer. AC came into the picture, your chairs, your tables accordingly came into picture so that you are comfortable and you sit for a long time at one place and work. Now the problem happens with AC is that you feel good and you're able to perform much more, but the side effect is it's very cold as well as moist inside. I mean, if you look inside a AC room, it's always very cold and moist.
Right.
So this cold and moisture will always cause some kind of the trouble, starting from your joint pains, starting from allergic rhinitis or cold and cough, very frequent cold and cough. Thirdly, you will have some other issues related to your digestion, or maybe much more related to actually your constipation and all, the
Okay.
passage of stools and all, because you are always in a cold climate.
Right.
And if you look outside, it's always, especially in the plateau region of India, it's always warm and a bit
Correct.
cozy, but warm kind of thing. That is where you should be spending much more time. Why
Okay.
do people these days say, okay, if I go to travel, पहाड़ों में जाता हूँ बहुत अच्छा लगता है, बाहर चला गया बहुत अच्छा लगता है, because they are in nature.
Correct.
As a human being, you cannot be confined between 4 walls. You have to go out. And whatever might be the situation outside, your body can deal with it. You are making yourself sick by sticking to these 4 walls
And creating
and
an
creating an
artificial
artificial environment for that instance. And in places like Canada or the Arctic area where it's cold outside, I can understand still you need a humidifier, heater. But again, if you see, these are not naturally habitat area. It's an artificial habitat area which we have created because we don't have land apart
Correct.
from that.
Correct.
So therefore, it's necessary to stay in places where the natural ventilation, natural things are much more. Second thing that would be good for your lifestyle is having fresh food. So whatever it may be, even if you have, like I said, bread or something, it has to be fresh. In Ayurveda, it is said whatever you cook needs to be eaten within 48 minutes after cooking.
Oh,
But it's very impractical,
difficult. Yeah.
very impractical these days. So I always recommend that at least during these days, whatever you cook in the morning, you finish it at lunch. If you're able to cook at night also as a dinner, cook it as a freshly prepared thing. If not, if any of these two conditions are not fulfilled, at least whatever you cooked in the morning, finish it by evening. Don't take it to the next day.
Okay.
Even though this is bad, but still something practical out of it.
Right.
Otherwise, you're bound to fall sick. ठीक है. And the falling, I mean, people say मेरा immunity low है, सब है. This small tweak can actually help you a lot to increase your immunity, your productivity, everything. See, the day you are actually healthy, you are naturally productive.
True. Very true.
So you need to just stay healthy. वो हिंदी में कहावत है ना, सर सलामत तो पगड़ी हजार.
बिल्कुल.
And everywhere health has been the main core.
True.
You need to focus on that health, and men don't do that.
Right. I agree.
Because for them it's like कल देखेंगे, परसों देखेंगे, हो जाएगा, कुछ नहीं होता है, मेरे को क्या हुआ है, kind of, because they have been trained or the society has told them you need to do things in a certain way. But if you don't take care of your health, tomorrow nobody is going to take care of you. So
Absolutely.
you have to take care of your health. So again, these two things, and all of this falls down to diet, ahar, nidra, brahmacharya. These are the three upastambha in Ayurveda, where your whole life depends on these three things: your ahar, your food, your nidra, your sleep pattern, and brahmacharya, how you have a sexual indulgence. All these three are most crucial. Okay, so in lifestyle again, these three factors would be taken care. Plus, like AC, I gave you an example. Uh, Most importantly, in lifestyle management, what I have noticed is I need to at times tell people they need to take break from their work, from whatever they are going out in doing in life. Just take a break. The problem is like these days on Instagram reels they show, okay, you need to take break at this point, not at when you are completely discharged or something. That really works wonders.
True.
Especially once you get recharged, everything falls in place. At times you need to break that monotony of your day-to-day activity just to ensure your mind keeps working. As a human being, we are hunters. Okay.
True.
And hunting requires a lot of focus, a lot of precision, and all the senses have to be very alert. With this kind of cozy environments, like a building kind of a structure, staying at one place, just working on the laptops, not interacting with people, our senses have become poor. And the moment these senses become poor, your body starts to feel that something is missing in my life. So you start what you call these days the mojo of your life. So then they do something odd or extraordinary just to find that kick or that mojo. They either go into drug abuse or alcohol abuse, maybe something weird out of nowhere they might do it. But all is because that senses needs that kind of stimulation as a survival mechanism. So therefore, for you, if you just go outside, go into the nature, take a walk, go on a break with family, maybe not family, go on a solo trip, you'll automatically, within 5 days, you will be totally fine and you'll come back and perform much better. So every year, going on a small breaks, not depending upon when your kids have a vacation, but when you need it the most, or when your project is almost on the verge of completion, you need the most, you should be doing that. So these things will definitely help you in the long run.
Right.
It's not about today or tomorrow. It's 10, 20 years down the line where these small things will actually work as a snowball effect, what they rightly said.
True.
Say, okay, it's just what you do right now will actually show up the result later.
True. Thank you so much, Dr. Rahul. Those were really good tips. And now we move on to the last part of our podcast, which is the quick fire round.
Sure.
So, Dr. Rahul, here are some quick fire questions which do not have a gift hamper.
I wish it had.
But something that we all in our audience would definitely know more about. So, beginning with the first question, many people say Ayurveda is slow. If a man has a bad infection or severe pain, isn't popping an antibiotic or painkiller faster and a better option?
Ayurveda is very much faster. In Pune, you can see those kind of conditions where emergency conditions are being treated with Ayurveda as such. Coming to the second part of the question, antibiotics or painkillers, there are many antibiotic or certain kind of herb combinations which work as an antibiotic. But if you want to prove it, like how these antibiotics work, and it's very difficult to prove. And like I gave you an example, we majorly work on the internal environment.
Right.
So accordingly, it works, and then it acts as an antibiotic also.
Right.
So it won't kill that virus, but it will ensure your body is not affected by that virus.
By the virus.
So in that way, it will be taken care of. And for painkillers, there are certain drugs right now not available, but in Ayurveda there are many such kind of components mentioned which work as an immediate painkiller.
Okay.
One of them right now being legalized is Bhang or Vijaya.
Okay.
So you have those hemp kind of products coming up, which are very good for these kind of conditions.
Okay. Second question. Is Ayurveda just a fancy term for home remedies and eating healthy, or is there medical science behind it?
A nice one. No, basically Ayurveda is a life science. So when I say life science, it means it teaches you how to live and what to do when you want to live a healthy life. Plus, whenever you are sick, it gives you a treatment protocol also. So it's called as Uddesh of Ayurveda is Swasthasya Swastha Rakshanam Aturasya vikar parimokshita. So the first aim is to maintain the health of a healthy person. Then, if you are falling sick, then what needs to be done? Aturasya vikar parimokshita, or the whatever illnesses will take care of that. That is what Ayurveda mentions. Now, the thing is, people compare it with home remedies, ghar ka nuksa, dadi maa ka batwa, and all those things. So it's like at previous ages, you did not have a chemist shop at every round the corner.
Right.
So therefore, they had certain remedies which people used to do with abundance of natural things available. They used to do, अच्छा ये कर लो, इससे आराम पड़ जाएगा. But it doesn't cure the problem. It will give you symptomatic relief or the temporary relief that you are looking out for. It won't give you a permanent solution. So there is a distinguishing difference between the two. When you say any home remedy or dadima nuksa, it's a temporary fixation.
Fix.
When you say Ayurveda, it's a permanent cure, or at least taking care of your illness completely in that
Right.
way.
There are so many Ayurvedic powder supplements for men in the market.
Mhm.
Are they actually safe and effective, or they are just sugar pills?
Now that is very difficult to answer, because if it's a good product or as a good combination plus a good ingredients, it would definitely be useful for them. But in case they make some gimmicks or they don't use the products which are actually mentioned on the label, then it's just a gimmick. In today's era, the chances of having gimmicks is much more.
Correct.
Because you don't know. See, there is no authenticity or any regulation from where it is sourced, how it is sourced, or whatever the components are. Jo mila, kai bar, as a doctor, you also cannot distinguish whether this is actual product or not. So, taking it by face value, it becomes very difficult to say whether it's going to be useful or not. But if you really see, most of the products might be useful, but again, it has to be taken under medical supervision. Don't do it yourself. Like
No
how in
OTCs.
W used to see, don't try this at home,
Right.
kind of thing. Don't try it by yourself.
True. Next question here. Is non-veg diet like chicken and eggs that men eat for protein actually bad for their gut health and energy levels?
Yes, it's very bad. So, again, the geographical climate plays a very important role. Like in northern plains or the northern part of India, for that instance, Himalayan regions and all, non-veg diet is good. It has to be consumed because you need that kind of energy, that kind of heat to be generated. But again, on the southern region, very less of that is needed. Secondly, what you eat also changes your mentality.
Right.
Okay, so if you're eating too much of non-veg diet, you become tamsi. Tamsi means you start falling depressed, you are very lethargic in overall activity and all. So therefore people used to say कि सात्विक खाना खाना चाहिए. Now they consider sattvic khana as just having vegetarian food. But it's not only the food that you have, it's also how it is prepared. So when I say a sattvic food, it has to be roti, sabji, dal, chawal prepared properly. Having misal pav won't be a sattvic food. Having onions or garlic, too much of onion, garlic ki gravy wala Punjabi food won't be a sattvic food at all. So depending upon what's the ingredient, how it's prepared, this sattvic, rajasi and tamasi kind of food are categorized.
Right.
For you to have a good energy level, for you to have a very healthy life, sattvic food is good. But if you are a athlete, if you are a soldier, then sattvic food won't be a good option.
Correct.
Then you need little tamasi food because you need that build, that muscle build for you.
Correct.
So then it has to be taken in caution and in proportion. And the whole problem these days with the protein is like people started it because they wanted to lose weight as a quick fix. Therefore, sudden increase in consumption of protein started. It wasn't actually intentional, it was more for the weight loss. But then because they saw people having it and losing weight, but along with weight, the muscle mass was decreasing. So the protein came into picture. Okay, have this protein, do this, do that. But again, anything that is in excess isn't bad.
Of course.
And if you today look at the latest medical researches, you will see that as the protein intake has increased to such a greater extent of 10x within last 10 years, suddenly there is a rise in number of kidney failures. Because at the end of the day, kahin se to bahar niklega.
Correct.
And when you have it in excess, it's going to harm you.
Of course.
So for your energy levels, for your gut health, for your overall wellness, you need to have in a very small portion, not on a daily basis, once a week or once in 2 weeks, only in that portion. And that includes either you have egg, either you have chicken, either you have mutton or fish. Only contradiction to this whole is those living on the coastal belt
Right.
or those living in very high altitude ranges like Leh, Ladakh, and all those places where you don't have any natural vegetation. There you need to have this.
Correct.
Otherwise, for anybody else who lives in the rest of the India, for them it's not good.
Right. My next question to you over here is, does low sexual performance in men always start with a physical problem, or is it mostly in the mind?
Mm, Majorly, it starts with the mind, as per my experience, because many people have stigmas, have certain notions regarding it, and very rarely you see a physical problem. But if it's, if you have evaluated on the mental aspect and you don't find an issue, that is where the physical aspect does come into play. But again, it would be like a 80-20 ratio, 80% mental aspect, 20% the physical aspect overall.
Can a man with family history of diabetes actually prevent it with Ayurvedic lifestyle changes, or his fate is already decided because of the genes?
Uh, it can be reversed. So these days you must have seen many diabetes reversal programs
Right,
being run a
right,
lot.
right.
Again, it boils down to the diet and lifestyle itself. There are certain changes that they have done, like having some music therapy or something like that. But overall, reversal is possible. Again, remember, it's reversal, not redemption or completely gone. It's a
Okay.
reversal. You need to take care. ऐसा नहीं है आपने फॉलो किया 2 महीने और उसके बाद ठीक हो गया, आपकी शुगर लो हो गई, and then you stop doing it. You have to continue it till the time you die. So therefore, you need to take care of it. So it's a reversal thing. It's
Right.
not redemption.
Right. Next here is, Ayurveda links physical health to mental health. Can you please throw some light on this?
So both are interlinked. So if you're physically ill, definitely you'll fall mentally sick, and vice versa. Your mind may ensure that you fall sick physically also. So there is one saying that Vishado Roga Vardhana Nam. So when Vishad means something that is troubling you from inside mentally, will amplify the amount of illness outside in your body. So it might be physical, it might be anything. So these days you find commonly you can see this in IBS patients. Okay, IBS patient or irritable bowel syndrome patients, over a period of time they become mentally very sick, and the moment they are too stressed out, they do panic. At that time, the IBS triggers. So both of them link together. That's what I wanted to highlight in this. Okay, you need to take care of both of them. And again, while taking care of both or treating any one of them, you need to again treat both of them together. They go hand in hand. Again, depending which is the prominent one, you need to take care of that first and then the allied one.
Right. Coming to the next question, doctor. For a man who's always stressed and angry, is this a personality trait or a sign of a body imbalance?
So for a person who's constantly angry, it's a imbalance of pitta dosha. So it's actually an abnormality. So when you say prakruti or a constitution, a pitta dominant person would be short tempered, but he won't stay angry for long.
Okay.
And he won't get irritated at smaller things.
Okay.
But if you're getting irritated at smaller things, you're constantly angry, shouting, yelling here and there, that means your body is telling there is something problem inside that is going on. So I'll tell you very good example to just elaborate on this. Many people who have anger issues and are not able to manage their anger, we always tell them to get detox done, Panchakarma done.
Okay.
After detoxification, all the toxins are thrown outside the body, say around 70-80%. After that, these people become very calm. And if they do it for 2 years or 3 years, nobody will be ever able to recognize that this person was once very hyper, very active, abusive kind of a person. So a corollary that my sister always says that तेरा पंचकर्म किया ना तो उसके बाद ऐसे लगता है सब मोह माया है. Because you start feeling कि this is not me. These are the toxins inside me which are making me that kind of a person.
Behave in a particular
Behave
way.
in particular way, correct. So therefore you need to get detox, and if you have these kind of anger issues or stress issues or maybe tantrum issues, you need to take care of it through detoxification.
Right. The next question, sir, here is, which now is self-explanatory, is detoxing or cleansing diets actually good for a man's body, or they are just trends?
What people follow these days is actually trend, but things like intermittent fasting, one meal diet, these are actually recommended by Ayurveda also.
Okay.
So ideally you should be having only 2 meals in a day. And since we work a lot on computers or we don't do physical exercise, we work more mentally. Therefore, a third small meal is okay.
Okay.
Otherwise, 2 meal a day is that all
More
we
than
need to be
enough.
take. In Ayurveda, it is said that the person who has only 1 meal a day lives a very long life. But what happens is the ONMAD, which is known as 1 meal day, they drink a lot of water, they drink liquids a lot. That is not what is expected out of it. And they expect that you should be eating only once a big meal and then nothing, only little water when as and when required. But people consume 2-3 liters of water, then coffees and all those things. That is not accepted. So therefore, 2 good meal you can enjoy. There's no harm. People think that I cannot eat too much at one time. Then what should I do? That's the other problem. Then 3 meals max. But otherwise, 2 meal is something that one should be having at any point.
Right. And the last question over here is, if a man has to choose one thing, going to the gym or fixing his diet, which will have a bigger impact on his health?
Fixing his diet, nothing beyond that. The food is said to be the most important aspect for nourishing each and every aspect of your life. Let it be the cells, let it be your mind, let it be your body. Everything is dependent on food. Therefore, if you fix your food, everything else will fall in place. Exercising would ensure that whatever you eat would get digested, but it won't ensure that it would get the body would get the nourishment that it is looking out for. But if you give a proper food, it will ensure that you get good kind of what you can say good nourishment, and thereby you stay healthy.
Right. With this, we end our podcast, Dr. Rahul. Thank you so much. You've shared a lot of insights and a lot of very important information that we all were looking out for. Thank you for taking out your time and helping us with this.
Thank you, Firdaus. It was a pleasure speaking with you and discussing on the topics. And it's a good initiative that you are taking for men and people to stay healthy. And I wish you all the best for that.
Thank you, sir. Thank you. So, with this, we wrap up this episode. And if you have liked the content and the information shared, and if you resonate with all that we discussed over here, make sure you hit the subscribe button and put your thoughts in the comment section and let us know what you would want us to talk more about, especially when it is about men. Men's mental health, physical, and the struggles or the challenges that men face. Until next time, take care.